Maybe 15 or 20 years ago, how many LCSWs would you have seen MBA after their name?
Right.
So what you're seeing is a change, and a change in not just the service delivery, which is wonderful examples here, but also in terms of the educational requirements necessary for us to be able to operate our services. And having these degrees are helpful in being able to provide operational efficiencies, which were shown here today. And so a round of applause to these folks for some excellent presentations. So what we'll do right now is open up for questions. So if you folks have some questions, we'll entertain them. Sure, go ahead.
So I just have a question. I was sort of taking notes on how you pick your indicators, and because for us it's like, well, how do you know the services are working? Well, people aren't getting evicted, and that's good, but there's so many little incremental steps.
Okay, so the question, so everybody can hear, is how do you pick the indicators and necessary to drive successful outcomes, correct? And the second part of it?
Is to sort of how, compared to what?
Compared to what?
For my services, this happened.
Okay, yeah.
Go ahead. For our part, the indicators were based on the things that we had access to as a property manager and landlord for our management index and incident tracking. So there were only certain categories that we could really look at that we had access to the information to.
I would also add to that in terms of how to pick the indicators is you want to think about what's important to you, whether you're a service provider or a manager. So for example, when I was making the dashboards for our team, I created a bunch, and then my team said, wait, but we want to know this. And so we added that, and we kind of tweaked it. So I think you can play around with what's important to who, and think about what you can include and what you don't need to include. In terms of compared to what, so we compared to HUD standards. I think your question was also, how do we know that this can be attributed to what we've done? Now, unfortunately, we're service providers and not researchers, so it's less important to me and Harlem United, and maybe an evaluator on my team may disagree, but it's less important as actually what did it, but as long as this group of things did it, and if you continue to keep doing this group of things, we'll be okay. So there is a methodology that we have, a Plan, Do, Study, Act. I may have mixed it up, Plan, Do, Study, Act, and so where you can actually isolate, if this was the cause of that. But again, it's less important to know which one of the four did it, as long as one of the four did it, and we can continue all four.
Right. The next phase of our training will be on multiple regression. Other questions? Yeah.
David, you talked a little bit about kind of taking the elephant out of the room and being able to kind of separate out your funding, what your funders need from what you need. And Kelsey, you talked a little bit about kind of proving things with data, but often I think a lot of us experience that we use the data to show our funders this is what's going on, or this is what your realistic expectations could be, or this is where we are as far as fulfilling our contract obligations and things like that. And oftentimes they may say, okay, great, your data shows there's only 15% that are open to this new program, but you said there's 25% that aren't interested. Well, why don't you just make them interested, right? Or, I feel like you can have a solid argument with data, but you still can't convince people. So could you talk a little bit to how you kind of get maybe funders on board with certain things and obstacles, how to deal with some of those obstacles?
Did everybody hear that? Yeah, okay.
One of the examples I was going to share and got wordy on some other issues was just to your point, like Common Ground, we have homeless outreach. And we looked at contact to placement ratios from a data perspective. How many times we contacted an individual, how many times we dated until they said, yeah, I'm going to marry you, right? Because you don't do that typically on the first date, the first contact. And so then we teased out of those that were rejecting placement opportunities, the why, to your point. And for many of them, one of the largest percentages of the why was I don't like what you're offering. I'm not buying it. I've rejected it. Okay, why did you reject it? Why are you not buying it? And it was things like, I don't like the rules. I don't like curfew. I don't want to give up drinking to get off the street. I don't I want help on my terms, not your terms, right? So, with Muzzy's background in government and his interest in public health, we were able, through a joint effort with the Department of Homeless Services, to entice mayor's office and private foundations to seed money, the first safe haven in New York City, that then the Department of Homeless Services picked up and now has 500 beds across the city. So I think you have to pick your target to make change. We'd like to affect change on all sorts of levels. It's not realistic. I think you can be armed with a compelling case and connect people to the goal. You know, are we interested in seeing those folks that we always see on the street, and we always ask ourselves, how come they won't ever get off the street? You, me, mayor's office, bureaucratic office, and here's the thinking behind it. Here's what the customer says about that, and are we willing to create a response? And so when the stars line up with data, with good analysis, and with an ability to articulate that, then I think things can happen, which is in our case resulted in 2 safe havens at the BRC and several others in the city. So I wish I could say we can affect that kind of change on everything, but I think if we can prioritize, we can see some of that positive movement.
Yeah, and just to piggyback off that, I think that's really important. That's where what happens is the data helps us to what we call innovate. Really take a look at what people are telling us about our services, and then taking that data and being able to go back to our funding sources and be able to say, this is what 60% of our people are saying. And then trying to work with them to affect some kind of change, which is what you just described, which I think ultimately is a positive use of data. Because what we don't want to do is we don't want to leave 25 or 26% of the people out there with no care. I mean, none of us do. But if we are looking at that, and none of us are happy to say, well, we service 80% of them. I mean, when I gave my example of, well, we're happy with 80, I'm not saying I'm happy with 80%. I want to make that 89, 90, 95%. And so finding out what we need to do to be able to help that other 20% only comes from collecting the data from the people, collecting the data from our funders, and collecting the data from our community.
I would add to that that data needs to be what I can't believe I'm sharing this in public. Data outside of Harlem United, data needs to be cute. It needs to be comprehensive, universally applied. It needs to tell a story, and it needs to be easily understood. And so if you can have a compelling analysis behind your data, that can be persuasive. And I'll to give you guys hope, I didn't include this in my slides because it's rather old, but there are clients who in supportive housing who are under the 30% rule, and those under the 330 rule, and I think it's a different number, 342 now or something. But basically, the 330 rule says that all of their benefits will be taken away except $330, and at the time, that's what it was. And that often puts someone in a very precarious situation in terms of being able to manage all of their expenses. We took some data and we compared the rent collection rates between people who were under the 30% rule and those under the 330 rule, and we showed that those who were under the 330 rule had a significant, probably half the rate of rent payments. So we were able to conclude that if people were given a reasonable rent payment, they would try to make it. If it was unreasonable, they wouldn't try at all. And so we were able to show this to funders, and our approach was to show it to one person, to say, look, in a compelling way, look at the data, look at what it says, and then to bring it to see if it could affect policy. And sure enough, what happened was HOPWA allowed for money on the contract to make the difference between what would have, in effect, be the 30% rule and the 330 rule, and that had helped all of our clients and improved our rent collection rates. So there is hope that it can change funders' minds.
I was impressed not only that, that your research methodologies were so rigorous, but also that so many of them were based on client surveying, that you were actually reaching out to the opinions of the clients and seeing what you could gather and seeing how it could change your practice. Especially with regard to rent collection, I found it very compelling that so many clients actually came out and put it out there that the reason they weren't paying rent was because they were spending it on drugs. I'm wondering if you had seen an opposite result in that, if everyone said, oh, I didn't pay it because of some other reason, would you have been as inclined to believe that they were being honest? Would you have presumed that the data was effective? And sort of broadening that question, are there certain questions that you wouldn't pose to your client population because of the presumption that they may not answer them honestly, and you want to go about gathering that data by other means?
Yeah. Well, thank you for the compliment. And part of the reason why a lot of our research is so client-centered is that we fully integrate our evaluation teams with our programs. And so a lot of the evaluation that's done is informed by the work done by our staff. I guess data is only as good as its source. And I think someone had mentioned that bad data is better than no data. And I guess there are ways to, if we would have gotten whenever we get data and that we kind of doesn't pass the stink test, we would dig deeper. So for example, one time to get a sense of how much, what was the prevalence of mental illness with our housing clients, oops. We'll do that study later too. We asked our staff how many of your clients are mentally ill, and we got something like 32%. We said, no, that's not possible. So then we said, okay, clinical directors and coordinators, please work with your staff to identify what that real number is, and that number went up. So sometimes you have to do a second pass at the data collection.
Let's say you track incident reports in a building. So if incident reports go up, maybe there's more incidents in the building, so the building's out of control, or maybe staff are being more responsive and more on top of things. So you can make incident reports going up sound like a good or bad thing, or them going down sound like a good or a bad thing. So just if you could shed light on that, I think the same with school suspensions, the same with arrests,
Yeah.
etc.
Yeah, well, I think one thing is certainly to start by digging deeper and I would ask that question, is there a change in the reporting frequency of incidents? I'm not sure if there's any ways to look at something like incident categories and see if there's changes in incident categories that are affecting those rates. I think it's also important to look at information over time and to see, and look at other factors as well. Was there a change that happened someplace else that might explain this?
When we collect it, we're catching it at a period of time. Sometimes it's a snapshot if we're doing consumer or employee surveys. But I think like what you're mentioning, Kelsey, is digging a little deeper, maybe even redoing the survey again. We've had the same kind of issues sometimes with employee surveys where we've had to redo them just because we didn't have an adequate response that we felt from a data collection standpoint was enough for us to make some determinations and some decisions on. Yep.
Hi, I'm Doreen Stecker from Jericho Project. Following up on that question a little bit, we're a much smaller organization and we don't have, sort of a separate evaluator or within staff or anything like that. So I get very concerned also about any time we do surveys that, I'm always asking my own staff to do the survey to their own clients. And so have any of you played around with, some alternate ways of getting surveys done or evaluations done, that type of thing that's still in-house, inexpensive, when you don't have, an evaluation person that can come in and do it?
We've used volunteers.
Okay.
Yeah, from both volunteers and academic interns. Both.
We also use SurveyMonkey. We've done that where we've gone out, and that's a web-based model, which you can set up yourself. It's pretty intuitive and very simple. So there's a lot. When you get out on the web, you can take a look at a lot of different ways to set up different kinds of surveys.
Have you done that with tenants or
We've done it.
staff or
We've done it with tenants, and we've done it with with staff, we've actually brought the pads right out into the field, into people's houses to do surveys. Yeah.
All those are great, and we've used all of them. Interns are always a free resource, are good. Also, I think it's, if you can create the environment, and I think by how the questions are asked, the nature of the question, which direction it's pointing, pointing towards, an affirmative or a negative question helps. Also, I think anything a client says can be used for something, worthwhile. And if you can train your clients, for example, we've done, I guess, a good job that our clients will say anything to us. And so that, if you can over time create the culture, that would work. And I just want to make a note that I do not believe that the housing staff have mental illness problems. Just wanted to make that clear.
Other questions? Yes.
I wonder if there's what the balance is between collecting data and using intuition or the judgment of your professionals?
Yeah, that's a great question, because it pops up in everything that you do. Intuition and judgment, intelligence is an important part of the process. The more people you have involved in that process helps to sort of tease out a lot of different things. So what we've done in the past is we'll collect a lot of the data and then put together a data analysis team. And they'll get together to take a look at it. And then it might take a little time for them to work through all the data, but it's done through an intelligence and judgment process, and it's an interesting process, and it's a lot of fun. And staff enjoy it. Staff really enjoy it.
I would add that it's important to use your judgment, similar to what we did with the example that I gave about the prevalence of mental illness with our clients. But also, I would also guard against ignoring data because it's not what you wanted to hear. So, for example, with staff satisfaction surveys, there are things that I thought, oh, no way, and that's just one person being really upset. But so you also want to kind of temper, changing the data or interpreting the data in a particular way.
Yeah, be careful to dismiss outliers. We're a lot of times too, we have this tendency to say, well, there are outliers on either end, and it's important not to just totally dismiss those outliers.
We have a crisis center that had utilization issues, and it was identified through a performance management system, and we tracked it, and we benchmarked it and realized that, to the point of somebody talking about setting goals outside of government, and we realized we just weren't achieving what we wanted to achieve, what we needed to. And so the intuition, the professional judgment was applied, and it was all very external. Well, somebody didn't do something from the hospital, and we need to improve the ability to communicate, and blah, blah, blah. So we implemented those changes, and we didn't realize a change in performance. So our best intuition, our best professional judgment at the time did not inform or guide a change. And so back to the point I made about relentless pursuit and ferocity or tenacity. And so through that effort, again, using the data, we realized it weren't them, it was us. And we had created barriers unwittingly, I believe, to access the care. And so we tore down those walls, and our utilization rate is actually incredible. It's beyond any expectation. So I think some variety of passes at the data to not look at the easy answer or not look at or dismiss the answer we don't like. But I see them as an art and a science, and they have to be in harmony with one another. They have to be blended.
Other questions? Yeah.
I think we all appreciate the value of data and aspire to do it well. But I do think for many of us there are resource issues involved. You need professional leadership of a good evaluation team to do it. Have you all invested, have your agencies all invested significantly in evaluation?
Yes.
Yes.
And what, like David said, it starts at the top.
Yeah.
It's got to start at the top because it's important. It's that important that it trickles down. But yes, I'll speak for us. Everywhere I've gone, it's at the top of my list of things to do. Yes.
everywhere you've gone, no matter the size of the agency.
No matter the size. I'll give you an example. I came from an organization that was a $5 million organization when I started 10 years ago. And that organization had 3 computers in the organization in 7 counties. The 3 computers were in administrative office, in the administrative office, and the executive didn't even have one. So in 10 years, we were completely computerized throughout the organization, and we grew the organization to just over 10 million. And it wasn't just from the computerization, it was from our commitment to make sure that dollars were going into technology and software strategically. It wasn't just being thrown in there. It was being utilized in a way that all of the staff, all of the, even consumers, were going to be using the technology in a way that was useful for them every day. Other questions? With that, I'll end on a data note. 85% of us made it through after lunch. Nice job.
Wow. Hey, good work.